Hello viewers, I'm back with yet another topic of discussion. Let's talk something about new. There's so much that people are talking about freezing everything. There's frozen food, you can freeze everything. So why don't we talk about how this concept of freezing has changed certain things in the field of medicine and infertility. So now there's a concept of fertility preservation that's catching up. Yes, you've heard it right. We can freeze the sperm, we can freeze the eggs, we can freeze the embryos, we can freeze the ovary, we can freeze the testes, we could freeze everything. All that you have to see and do is go and talk to your doctor about what is applicable to you. But first, let's talk a little about how freezing helps. There are a lot of medical conditions. The top of the list is cancer. The moment somebody is diagnosed with cancer, the first thing all of us think about is saving the life. Yes, of course, saving the life is important. But what we forget in young people, when we're treating them for cancer, the treatments are so developed and improved that the next 10 or 20 years, there's absolutely no risk to their health and life. So after they finish the cancer treatments, at some point when they're around about 25 or 30 years, there comes the question of marriage and pregnancy, and then there's a lot of damage that the cancer treatments, the chemotherapy and radiotherapy as a part of the treatment would have damaged the ovary of the woman or the testis of the man. As a result, the sperm count becomes nil or zero, or the woman is no longer able to produce the eggs. So pregnancy gets very difficult. For in such people, before we could start the cancer therapies, a simple measure of freezing a sperm sample or the eggs of the woman could go a long way. Once the people finish their cancer treatments, they can come back, and this frozen tissue can help them conceive their own genetic child. And the freezing techniques of late are so improved that you could freeze anything, the egg, sperm, embryo that I'm talking about, for any number of years. There's going to be no problem in preserving them for a very longer period. There's enough research and development and publications to tell us that freezing would not affect the health of either the mother or the child. So semen freezing is something that's very easy. It's accessible. Most of the centers in your city are offering sperm freezing, oocyte freezing, and the embryo freezing. Just go talk to them and see. What are the other places? If cancer is one such a thing, I'm giving you an example, but there are other things as well. And off late, we see a lot of social freezing that's catching upon. Yes, career is so very important for all of us. And we do not want pregnancy to come in the way and put a stall on all our dreams, all our hard works, and the difficult careers that we've built up. So all that you could do is just go and freeze your egg or sperm, and when you really think you found the right man or the right person, or you think that's the right time to conceive, you could go and use the frozen sample and conceive and build up your family. And why social freezing has come into the picture? Because age is something that's very important. As the woman ages after the age of 35 or man after the age of 40, the production of sperm and the egg and the potential of pregnancy, everything goes down, and there are a lot of medical challenges. So before the age can tick, before we could wash out our hard-earned dreams, let's think about the simple option of freezing your egg and sperm. Talk to your doctor today and get more information. Thank you so much.